Hey lovely people, welcome to Learning with Violet Okalacha. How are we all doing? How is preparations for our Osce exam? I trust we're doing all right, okay? So in today's video, we are going to continue with our learning series on evidence-based, and we're going to be looking at dementia and music marking criteria. Just continue with our evidence base. But before we dive into the video, I just have two special announcements. Number one, if you're writing your OSCE exam soon, oh my god, just relax. OSCE remains simple and nurses are brilliant. You are definitely passing. All you need to do is to practice with your friends, practice with your peers, and remember to watch videos with marking criteria just so you're sure they're doing the right thing. All right, and you'll be successful. I can't wait to congratulate you. Yesterday alone, 5 of my own online students has passed, and about 7 people messaged me, thanks for your help, I passed. So that's a total of like 13, 12 people who I congratulated who passed on Friday, Saturday. So well done, you're definitely passing. Secondly, I've added the join button to channel members. So if you click on that join button, you become eligible to be a channel member. And I have a lot of juicy videos for channel members. Like I have nutritional assessments, very in-depth. I have administration of suppository. So if you fancy being a channel member to have access to those videos, and if God willing, this Monday, Wednesday, I'll be editing the video on Afima disease and I'll upload it for channel members. So if it's something you fancy, just click on the join button to become a channel member and enjoy the benefits. And also, when you ask a question as a channel member, I am mandated to answer you. So that's the benefits of being a channel member. So without wasting time, let us dive directly into our topic for today.
Ryan Little.
Alright guys, welcome back to my channel. Let us learn together, and we are learning evidence-based series today, and we are looking at dementia and music marking criteria. So for any evidence-based or professional values, guys, you have complete 10 minutes to complete the station. It is a silent writing station, so write clearly and write legibly. The marking criteria is the answer, but however, write as you want, read the marking criteria, master it, and you can write the same meaning as the marking criteria without using the same words, as long as it has the same overall meaning. It's entirely up to you. So what do you expect for this? The first thing is you get a plain sheet of paper. Let me share that with you on the screen. That is where you write your answers into. And the next thing is you get your evidence-based practice. I'll just read it out from here. So you the form you're going to be getting is going to be tagged evidence-based practice, and they will say dementia and music. One, you're also going to get an overview, and the overview is something like this. I'm reading it out, I don't want to post it. Read the scenario and the summary of the research below. Please identify the main point from the summary and apply your findings to the scenario below. This is a silent writing station, so please write clearly and write legibly. You have 10 minutes to complete the station. Now, after that, you get a scenario. I'm going to be reading the scenario now. Music therapy can give positive side effects to patients who have dementia. I'll repeat the scenario. Music therapy can give positive side effects to patients who have dementia. Now, after your scenario, you get an article summary. Now, I want to read the article summary. A systematic review in a well-guided peer-reviewed journal of dementia investigated the effect of music on dementia patients. Study A. Research trials have been conducted where music therapy have been introduced, and they have seen some benefits for individuals who have dementia. Study B. Research have shown that there is lack of evidence that music therapy can improve agitation. Study B. Research have shown that there is lack of evidence that music therapy can improve agitation. Study C. Music therapy can possibly improve depression, and this is the rationale for implementing music therapy. Study C. Music therapy can possibly improve the depression, and this is the rationale for implementing music therapy. Study D. Music therapy may have positive side effects on the overall quality of life of individuals who have dementia. Now, the review conducted stated that there is no clear evidence on how long the effect created by music therapy remains after the activity stops. The review conducted stated that there is no clear evidence on how long the effect created by music therapy remains after the activity stops. Now, you see, for any evidence-based scenario, you get your words, you get your overview, you get your scenario, and you get your article summary. Now guys, one advice I'll give to you is pay attention to your article summary. The article summary are almost same with your answers, so pay attention to them. All right, if you miss anything, pause this video and go back and get it correctly. All right, so now these are my sample answers, and the sample answers I am giving you are the same as the marking criteria. Like I told you earlier in this video, read the marking criteria, use your own ways as long as it has the same overall meaning. A lot of people have said, Nosvallet, I use exactly what you use and I pass. That's absolutely fine. So now I want to give the answers and I'll post the marking criteria answers as well. So number one, I would inform Mrs. Ailey that research have proved that music therapy. So I would inform Mrs. Ailey that research has proved or research has shown that music therapy have some benefits to individuals who have dementia. Keep it simple. I would inform Mrs. Ailey that music therapy have some benefit, that research has shown that music therapy have some benefits to patients who have dementia. Tick, lovely, fantastic point. Number two, I would inform Mrs. Ailey that there is lack of evidence that music therapy can improve agitation. I would inform Mrs. Ailey that there is lack of evidence that music therapy can improve agitation. Tick, fantastic second point. Now, number 3 point, I would inform Mrs. Ailey that music therapy can positively improve depression, and this may be the rationale for implementing music therapy. So I would inform Mrs. Ailey that music therapy can possibly improve depression, and this may provide a rationale for implementing music therapy. Fantastic third point. Oh my God, tick. This is definitely a pass. Number 4, I would inform Mrs. Ailey that music therapy may have a positive side effect on the overall quality of life of patients who have dementia. I would inform Mrs. Ailey that music therapy may have a positive side effect on the overall quality of life of individuals who have dementia. Fantastic fourth point. Tick. And number 5, I would inform Mrs. Ailey that there is no clear evidence on how long the effect of music therapy remains after the activity stops. I would inform Mrs. Ailey that there is no clear evidence of how long the effects created by music therapy remains after the activity stops. Fantastic fifth point. And this is all you need for dementia and music. Oh my God, what a simple evidence-based to handle. I can't wait to congratulate those who will be having this. Thank you so much for watching. If you have not liked this video and you have not subscribed, make it my pleasure. So please like, subscribe, and don't forget to share with your other colleagues preparing for Osce exam. I will see you in my next video. Until I see you again, keep passing your Osce exam. Remember to send me a DM when you pass. I love you all, and bye for now. Thank you.